So here is the American Stroke Association recommendations or guidelines, what you actually should do with stroke patients. And it's just interesting that recoveriX is covering a lot of the suggested treatments. What you can here see is the class from 1 to A, 2B, to 3. 1 means it should be done, 2A is reasonable, 2B may be done, and 3 means there's no benefit. And here you can also see the level of evidence. So how many papers existed, this is important. And what you can see is that recoveriX is actually doing task-specific training, so people have certain things to do. We have also left and right mental practice. So they have to do either the left or the right hand movement, paretic and non-paretic side. This is similar to constraint-induced movement therapy. We have mental practice, of course. They have to do movement imagination. We don't have the strengthening exercises, but this is also something that we don't have to do with recoveriX. People can just do it at home. But we are doing bilateral training to activate both hemispheres. We have virtual reality training. It's the avatar in front of the patients. We don't have robotic therapy, but we are doing the functional electrical stimulation. This means that we are more or less doing everything here, which is recommended. What we are not doing is acupuncture, but there's anyhow no benefit according to the US guidelines. Then there are also Canadian stroke guidelines for therapy. You can see here's the table what you should do within the first 6 months and after 6 months. And A means there's evidence from a meta-analysis, so a couple of papers are showing that this has an effect. B means there are single 1 or 2 studies showing the effect, and C would mean there's no study actually showing there's a benefit. And you see we are doing mirror neuron therapies. People are looking at the avatar, they are seeing the movement. We are doing mental practice, it's an A. We are doing this constraint-induced movement therapy. We have both sides. Strengthening training is done at home. Bilateral arm training is done. Training of active movements is done. And the functional dynamic training is also something that we can do more at home. Of course, we do the dorsiflexion. Then you could also do range of motion exercises, but this is a C. We do the virtual reality training, it's an A. We do the functional electrical stimulation, it's an A. What we don't do is direct current stimulation, acupuncture, but we have the biofeedback as a BCI component, but also with the classification accuracy. What we don't do is TMS because we work mostly with chronic patients, and DDCS, there is more or less not enough evidence for the moment. So we are doing many recommended therapies at the same time, and this makes also recoveriX very efficient. But in addition, we have, of course, the BCI component, which is coupling cognitive processes together with to the motor movements, and this makes it even more effective. Here you can see recoveriX worldwide. So we are also in Australia and in India. It's not completely up to date. At the moment, recoveriX is running in more than 30 countries around the world where patients are treated on a daily basis. The gait rehabilitation study with recoveriX is also published in Frontiers in Neuroscience. You can also very nicely download the publication and see in detail what we did. In doing the stroke clinical study, we got also interested in multiple sclerosis. So we designed also a clinical study to look at these patients. So in multiple sclerosis, actually the myelin is affected of covering the nerves. And this has the consequence that action potentials cannot really travel that fast along the nerves, and the movements are delayed or they don't happen at all. Multiple sclerosis is bilateral, and here you can actually see how the action potentials travel on a healthy neuron. You can see this myelin covers around the nerve. You can see the action potentials are pretty fast. On the left-hand side, you can see an axon without this myelin coverage, and then they need much longer or they don't reach the other end of the nerve. Maybe you have seen the lecture from Justin Williams. He showed that these nerves grow very quickly inside the myelin, which is also, well, was a super interesting keynote lectures. So multiple sclerosis patients have muscle weakness, they have balance issues, they have body parts affected, left hand, right hand, left foot, right foot. Very often is also that the feet are somehow glued to the floor, so they cannot really walk in a very elegant way. So they have to do the onset again and again. They walk slower. And also a big problem is fatigue. So they cannot walk very long or very wide. So a treatment goal is to have better gait so that they can walk longer, faster, to reduce spasticity, to improve balance, to uh, lead as a consequence to more physical activity, increase the quality of life, and also to make fatigue better. And for that, we needed a protocol which is actually activating all four limbs, left hand, right hand, left foot, and right foot. And this is done in the first therapy session by activating one leg versus the contralateral hand. So this is the leg movement. It's randomized. And then we are also asking the contralateral hand to be activated. So this is done in the first therapy session, and in the second therapy session, we are taking exactly the opposite leg
left,
and the other hand.
relax,
He is again trying to touch the wall,
right,
and this is the leg. And in this way, we can actually activate all
relax,
four limbs, and that's a requirement for multiple sclerosis. Here's already a patient who trained with recoveriX, lived for about 30 years with multiple sclerosis. So people get MS on average with 34 years, so it's very young. And then, of course, they get worse and worse. So doctors are giving them medication. There are about 25 different medicines that you can use, but it's very difficult to select a proper one. And it's more or less trial and error. And this medicine is given to slow down the decline, but nevertheless, they are getting worse and worse. And we wanted to make multiple sclerosis patients better again. So on the left-hand side, you can actually see the MS patients before recoveriX. On the right-hand side, you can see the patient after recoveriX. This is just a walking speed test. You can see here on the right video, he moves much faster, looks more confident, body is more straight, and he needs 15 seconds for the 25 feet step test. The left-hand side, he was much slower, needed 25 seconds, so we have an improvement from 25 to 15 seconds after about 20 hours of training. And on the bottom, you can see the 6 minutes walking test. So we are just asking them to go as far as possible within 6 minutes, and we are measuring the distance. So you can see here this little measurement wheel. Rosie is following the patient for 6 minutes, and then we know how many meters they can actually do. We are doing two pre-assessments before we start with recoveriX on 2 different days. And you can see the patient could do before and 77 or 85 meters, so it's pretty stable. And then we started with the therapy, and he went up all the way to about 150 meters after the recoveriX therapy. And very interesting is for him session number 7, because the patient didn't believe so much in recoveriX, so he thought, I'm just wasting my time. This will not have any positive effect for me. And suddenly the spasticity was reduced in his left leg, and he was able to move the leg again. This made a huge difference for his life quality. So he is saying that now he can stand up straight again. This is, for example, visible when he's cleaning teeth. His concentration improved, standing up and sitting down improved, and he has in general more stability and balance. And for the first sessions, his wife was bringing him to the therapy, but afterwards he felt so much better that he could actually drive himself. And the best thing actually is that during night when he's sleeping, he can turn him around when he's lying himself before, and he needed always his wife every couple of hours to turn him around because he got also a lot of pain when he was always lying in the same positions. And with the additional leg movement, he was able to do this again. Here's another multiple sclerosis patient. You already know it. On the left-hand side, it's before recoveriX. The right-hand side, it's after recoveriX. So what you can see here is that she's using the 4-point walking stick. On the right-hand side, she can do it much faster. And on the left, you can see that the feet are somehow gluing to the floor after every single step. Then the walking is interrupted. And this doesn't exist on the right-hand side anymore. I play it again. You can see the walking is pretty regular on the right and interrupted all the time on the left. That's a symptom that we see very often with MS patients. It's just very good if it goes away. So this patient improved, for example, from 40 seconds to 19 seconds. So it's more than double speed. And if we look at the 6 minutes walking test, then before recoveriX, she could do something like 34, 39 meters. And with every single recoveriX training, it got more. At the end, she could do 101 meters within 6 minutes. It's about 3 times more. This is, of course, very useful because with 100 meters, you can already do a lot in your house, in your apartment, in the garden. And yes, she was also saying at the beginning of the therapies, I was coming in a wheelchair and she could do about 20 meters. And then she had to break very often and pause. After the therapy, she's now walking with a stick. She goes outside more often. She's more joyful, less sleepy. She's able to lift off her foot better. While standing, the foot sticks a lot better to the ground. She liked it here in the gym. We call it recoveriX gym. Super cool. Coordination of the movements has improved, whereas the concentration and the memory were always good. The 6 minutes walking test performance doubled. She switched out her 3-point stick with a Leaky stick, which looks much more normal. And finally, she also stated increased strength in her hand. And afterwards, she was able to play mini golf again. This is something that she didn't do for many years. So in the clinical study, we had the modified Ashworth scale. You already know it for measuring spasticity. We had the video recordings, like I have already shown you, time up and go test to stand up, walk a circle and sit down. Timed 25-foot walking test. This is the video that I just showed you to get gait speed. The 6-minute walking test for endurance. And we also looked at the multiple sclerosis impact scale in daily life activities. And also at the modified fatigue impact scale, because fatigue is a very big problem for MS patients. So sometimes they can be active for like 50 minutes and then they have to rest again. And here you can see the outcome. Time up and go test improved highly significant, 0.001. This means almost everybody is improving when we are running recoveriX or multiple sclerosis. 6 minutes walking test improved highly significant. Multiple sclerosis impact scale improved very nicely, so people feel MS much less. And very satisfying is that the modified fatigue scale got much better, also highly significant. Remember, not everybody has the fatigue. And this means they feel much better and they can do much more. We had, for example, a language therapist from Vienna. Before recoveriX, she was treating one child. And afterwards, she had to go to sleep. After recoveriX, she was doing 6 children after each other. And then she went shopping just because it was possible again after recoveriX training. You can also see the time 25-foot walking test proved highly significant. They walk faster, and also the Ashworth scale was significant. Again, a little bit less because not everybody has spasticity. And we have also a franchise concept, or we make also partnership agreements with physiotherapists, with physicians, with hospitals, therapy centers. And then you can actually run your own franchise center. So what you need is an entrance area, of course, reception area, training stations, can be one room or for each recovering center, but you can also put a couple of recovering systems into one room and restrooms, and then you're all ready to go. We have also a rough investment plan, so how many patients you have to treat and how much income you can generate and per person or per system. So roughly you can do up to 90 patients per year. Here in Austria, we are charging 80 euros netto, 69 euros brutto per session. So this is roughly 2,000 euros for 25 therapies. And if you're a physiotherapist, then you can, of course, do the treatments yourself and you don't have to pay the salary. If you have to employ somebody, then you have to pay also the salary. Maybe you have to rent a room or you already have it. For recoveriX, basically you need a table, then you can put on the recoveriX and you can go ahead. And what is very nice is that one physiotherapist, one nurse, or one physician can actually run up to 3 recoveriX systems at the same time. And then, of course, your time is used very well. And here you can see different franchise opportunities on the website. We have, for example, in Spain, different districts, and then people can open a couple of centers at the same time to utilize the effect when they have already something running. In Slovenia, Sergey is, for example, in the panel. They are running recoveriX in Maribor, in Kranj, and also in Dobrna. That's a center where about 50% of all the stroke patients land in Slovenia. So it's a very nice distribution here. And they have also Andras, a medical doctor in the team. Then they have a couple of physiotherapists in the team. And this is super nice because then you have all the expertise in one center. Here you can see they are charging 1,850 euros for 25 therapies. So this is about 74 euros per therapy itself. And the media is also aware of what they are doing. So they are very often in the media and they have also contracts with different insurance companies. For example, Saba, I think it's the second biggest in Slovenia, or Merkur, if you have private insurance, and they are covering parts of the cost. And here in Austria, we can also see the center where we are located in Schiedlberg. The first other center was, for example, in Linz in Austria, and then in Schladming in Vienna, and then it's also running in Graz and also in Steyr in Innsbruck. So we have already a pretty nice coverage. I mentioned it already before, the Austrian social security system pays or co-finances 60 euros per treatment. And then you have to pay just the rest yourself. If you're going to a neurorehabilitation center in Bad Hall, it's not on the map, but it's located somewhere here, then the treatment is for free because it's a standard neuro rehab. In Germany, we have, for example, centers here in Munich. They are running now 2 recovery centers, systems, because they have enough patients. Then it's in Passau, in Dresden, in Berlin, Frankfurt, and so on. And in Finland, this is actually the country that started first with recoveriX treatment. You can find it, for example, in Tampere, in Helsinki, and a couple of other locations. And very interesting is that Finland, for example, uses recoveriX also for chronic pain. So physicians are already sending patients to recoveriX centers if medication doesn't work anymore. And here's a country list where private institutions are running at the moment recoveriX, so that you can really go there and receive a therapy, for example, in Australia, in Romania, and Switzerland. And the list, of course, is extending. This is one example in Bangkok, where China is running the recoveriX center. So this is the entrance area. You can also see here some videos of recoveriX, the waiting area. And after the multiple sclerosis study, we also started with a Parkinson disease study. And for Parkinson disease, we looked also at many different assessments. So one of that is the Unified Parkinson Disease Rating Scale, the UPTRS. This is the most important assessment that's used for Parkinson's disease. And that's also the reason why we have it, of course, in our clinical study. And then we have also video recordings before and after recoveriX, the time up and go test, because many of these patients have problems with locomotion. 10-meter walking test, many of these problems have problems with gait speed. And then we had also a questionnaire for freezing of gait. This doesn't occur so often, but sometimes, they cannot move anymore. They're just standing and then they have to wait for 10 seconds, sometimes a minute, until they can move again. That's called freezing of gait. And then there's also this Parkinson disease questionnaire, 39 questions, how severely Parkinson affects you. We looked also at the modified fatigue scale to get an understanding if we can improve fatigue. And we put also an accelerometer on the hand or on the leg if they had tremor. And we used also the 9-hole peg test to quantify fine motoric skills. And here you can already see a video of one of the Parkinson participants before and after recoveriX. So on top is before and the bottom is after recoveriX. This is walking speed. And here you can nicely see that she can do it faster, but you can also see that the movement is more confident. And if you look at the numbers, then before recoveriX it was 9 seconds, after recoveriX it was 5.6 seconds. Very nice improvement. The very good test is the timed up and go test. So here you can see she jumps up, makes the circle pretty fast. Now watch when she sits down. Looks pretty good. Here the confidence is not there yet. Watch carefully when she sits down. Much slower. This shows also improvements in motor behavior and balance. And this was reduced from 27 seconds to 13 seconds. It's about half of the time. And then I can also show you the trend. Here we have a lot of engineers, and you can see in the pre-assessments, she needed between 26 and 27 seconds to do the timed up and go test. And then with every single recoveriX therapy, she was getting faster and faster. At the end, she needed like 13 seconds. That's a very good number for the time up and go test. For the 10-meter walking test, you can also see beforehand 13 seconds. And then with recoveriX, she was faster and faster. At the end, 7 seconds. This is almost like a healthy control, but the trend is very nice. You can actually also see how quick this goes for gait speed. So it's easier to improve in gait speed than in the time up and go test because the movements are more complex. Standing up, making a circle, going back requires more balance. And interesting is, of course, to look also at the upper limbs. So here we can see improvements of the box and block test. In this case, you just have to drop little blocks from one side to another side, and you are counting the blocks. You can see the healthy and the paretic hand, the left and the right hand, both improved. And also the 9-hole peg test. So in this case, the time should be faster if you can put in the pegs in quicker. You can see even the more affected hand was at the end like a healthy person. So 30 seconds is a pretty normal value for the 9-hole peg test. We looked also at spasticity and muscle functions, but I skipped the slide. And here's another example of a Parkinson patient on top before recoveriX, on the bottom after recoveriX. Look at the bottom, that's like normal movement. I watch carefully when she sits down, I'm very careful. I make it again, look at the bottom, so I wouldn't see anymore that this is a Parkinson patient, isn't it? Clinical study. So we are looking at the UPTRS, and you can just see before doing recoveriX, after doing recoveriX. So we have also a significant reduction of our questionnaire. And then we are also, so the Parkinson study is still running, but we are also looking at other pathologies, and one of these illnesses is Kronos-Cauda syndrome. So this gentleman was at home. He didn't work anymore because his chronic pain was so severe that he was actually quitting his job. So the social security system is paying actually his salary, and you can see again before and after the time up and go test. So you can already see standing up is much easier. Then he walks the circle. On top, he's much more careful. He sits down. This is an improvement from 21 to 15 seconds. And we can also look at the walking speed. So if you watch the video on the bottom, it's almost like a healthy person, a little bit slower. And you can also see in the video that he lost actually weight because of his chronic pain. He gained weight because he didn't exercise anymore and he felt permanently ill. And after recoveriX, he is now saying that he feels completely healthy. And this is 6 years with chronic pain. So he was saying he has 5 out of 10 points. Permanently, he also had a tinnitus and limited functions. Medication didn't work for 6 years, and then he invested 18 hours of recoveriX therapy, and afterwards he was pain-free, permanently pain-free. Tinnitus was better, motor functions better. He's just saying he feels completely healthy again. So in this case, also recoveriX made all the difference. Here's another video. Fastest velocity. So on the bottom, you can see he needs 3.7 seconds. That's like a healthy person. Very nice. And then we looked also at long COVID because we noticed in multiple sclerosis patients that fatigue gets much better. And in long COVID, fatigue is of course problematic. So he invited also some long COVID patients. You can see here the 6 minutes walking test. So they have to go as far as possible within 6 minutes. So this patient in the two pre-assessments could do around 380 meters. So it's very similar. Then you can see with every recoveriX treatment, it got more and more. At the end, it was 450 meters. This is like a healthy person of this age. Then we can also see the fatigue scale. So these two bars are before recoveriX, this is after recoveriX. So fatigue improved nicely, sleeping improved nicely, and also mocker concentration performance improved nicely. It actually was normal after recoveriX. This is a very nice side effect. So concentration memory gets better. We are seeing this for all the patients, stroke, multiple sclerosis, Parkinson, and also here for long COVID. This is, of course, also very useful to have. Here you can also see box and block test. At the end was better. 9-hole peg test got better, faster. And I skip the details. And here you can very nicely see the trend again. This is now incomplete spinal cord injury. This is also something fascinating because up to now we only investigated patients who had problems in the brain, but we never looked at people who had spinal cord injury, so not brain related. Then you can also see in this example that recoveriX was helping very nicely. So this was before recoveriX, 42 seconds for the time up and go test. Afterwards, 26 seconds, 15 seconds better approximately. And also the 10-meter walking speed, you can see for recoveriX and after recoveriX, also about 10 seconds better. Very nice. So this was actually a worker falling down while he was covering a new roof, and he injured his spinal cord. Here you can see it on the left before recoveriX, on the right after recoveriX. So this is of course incomplete spinal cord injury, so some fibers in the spinal cord are still existing. And with neuroplasticity in the brain, I guess we are using the remaining fibers more efficiently. And this explains the better movement. So watch when he's sitting down, pretty quick. And we can also watch on the left. You can see this is much more complicated. Very careful. So this increased from 42 seconds to 28, 18 hours of training. Doesn't matter. And then we have also 10-meter walking test. This is gait speed. And also from the back, you can see nicely the difference. Walking straight is, of course, always easier than time up and go test, which is much more complex. But also here we see from 22 to 17 seconds, nice improvement, only 18 hours of treatment. And here's another incomplete spinal cord injury patient. He started with 29 seconds before recoveriX. You cannot see also his wife is beside him because she was scared that he might fall. And on the bottom, he's just doing it himself because he got so confident, and also his family got so confident that they don't assist him anymore. And that's also a big improvement from 29 seconds to 13. 16 seconds faster. This makes a huge difference when you are walking around at home, and exactly what we want to have. And then Rosella Spataro had also in Sicily somebody with Guillain-Barré syndrome. And that's a very nasty illness. So within 4 months, the gentleman was almost completely paralyzed. So he couldn't move the hands anymore. He was in the wheelchair. And if you look at the MRC scale, then you can see almost everything is a 0 or a 1, which just shows for elbows, wrists, shoulders, that there's almost no motor function left. And after recoveriX, you can see the motor functions improved a lot. No 0, lot of 1s, 2s, and 3s. And after the therapy, he was actually able to lift the hands again. So also for him, recoveriX gave him his life back. Otherwise, he would be completely paralyzed. Guillain-Barré syndrome. It's very good that this is very seldom. And then we investigated also a football player who had a nerve damage in the left leg. So this is again lower down the body, further away from the brain. So it was a nerve in the leg itself. You already know the story above before recoveriX, on the bottom after recoveriX. You can see he just moves much quicker. 15 seconds before, 10 seconds afterwards. So it was actually his right lower leg. And also here, the movement became better. Actually, the foot started to lift a little bit again. And this made at the end the difference for the gait speed. And with that, I would like to end my presentation. Let's check if we have any questions here. I can also look for George in the meantime. George is already in the attendees list, so I promote you. Somebody's asking, will more game types be made available for recoveriX via updates, or is it each game specifically designed to be medically registered? So we will integrate more games, and now we are MDR certified. This means we have also an efficient way of releasing games again. It's just depending on the functional electrical stimulator and the hardware setup if the games will work with every future recoveriX system. So at the moment we have 2 games, the drums and the red game that you can use, and of course the standard avatar. Sign up says, I'm from Lebanon. If I want to work on research on Parkinson, how can I ask for the Parkinson questionnaire and research kit? Parkinson questionnaire is just a standard questionnaire that you can find on the internet. So just get it. There's also a nice instruction how to do it. And then you can quantify how much they're improving. Laser is saying multiple sclerosis caused by Epstein-Barr virus. How does the BCI system function then decrease the symptoms? This is actually what we are not doing, so we have no effect on the multiple sclerosis itself. The only thing that we can do is to make spasticity, movements, and so on better. A very interesting side effect was also the bladder control got better. So people were going 5, 6 times to the toilet during the night and afterwards much less. This was highly significant. We just didn't monitor it in the clinical study because we didn't expect it. But we are not doing anything against the multiple sclerosis itself. It's just a neurorehabilitation. But what we are doing is we make people better again. And this is what multiple sclerosis patients are normally not hearing. Doctors are just speaking of medication to make the decline uh, slower, but nobody has any treatment which makes them better. And the neurologists are also saying there's nothing what you can actually do against fatigue. Fatigue is there. There's no medication. There's no treatment. There's just nothing to make you better. And we have seen it now many, many times that fatigue gets much better if you are doing recoveriX, not only in multiple sclerosis, but also in long COVID. And then somebody's asking, did the Guillain-Barré syndrome also receive standard immunotherapy? This is something that I don't know because Dr. Spataro from Sicily was doing the treatment. So I don't know. Likely they applied some medication, but so I guess we have answered all the questions.